biggest agenda items that include us and Johnny, maybe down further on the agenda anyway. So, okay, with that, I'll call the order the meeting of the Polk services for today. Roll call, please.
Francis Duncanson,
Here.
John Bonner, John Olson, and Darby,
Here.
Frank Johnson,
Here.
Kelly's excused.
Steve McKee, Dave Magapici,
Here.
Dr. Wilbur.
Okay. And with that, I'll entertain a motion to approve.
I'll move to approve the agenda as presented.
I'll second it.
Okay, the motion's been made and seconded to approve the agenda. All in favor, start by saying aye.
Aye.
Opposed, same sign. Item number 4 is the approval of minutes for the November 4th, 2025 meeting. Everybody had a chance to review them. I'll look for a motion to approve. Okay.
I'll second.
Motion's been made and seconded to approve the minutes from the November 4th, 2025 meeting. All in favor, please respond aye.
Aye.
Opposed, same sign. Okay, nobody's opposed, motion carried. Item number 5, public comment. Do we have any members of the public online who would like to comment or here? I don't think we have anyone here. Anyone online? Does not appear that way. Going once? Okay. So, with no one having public comment, we'll move on to agenda item number 6, which is receipt of information from supervisors not seated as committee members. We don't have anyone here. It's not on the committee. So with that, we will move along to agenda item number 7, which is the discussion and review of chapter 60 smoke-free air. So that was something that consensus agreed at our last meeting. We would kind of review on our notes. And then if anyone had any suggestions on that, if they could bring them forward, we'll take a look at it. I took a look at it, it seems pretty standard to me and in accordance with, statute, so I didn't see anything.
Oh, okay, I see that.
Well, it is
One of the attached, the other attached.
I'm not sure.
No, I think you would have to actually go for it.
Last meeting, they had asked to go into the ordinance. But we did it.
Okay.
So there's a few things that we would change, so I think
Yeah, please. Yeah, please. I did not, but if you see something that, take a look at.
so most of it is just language, and some addition with some stuff. It's,
I didn't think they,
apple products.
it's a thing now.
Okay, so, same as last time, red lines are the changes, collections, should be pretty straightforward. Can everybody see it? Or do you need it brought up a little bit larger? Tiny bit more, a little bit more.
I'm squinting, but I was.
You were gonna be the first one. Thank you. Thank you. Okay. Otherwise, we can all huddle around.
Perfect.
Okay, so, so we just changed the cigarettes and tobacco product to, smoking and other uses of tobacco. That would be all inclusive of all of the different types of vaping devices that are out there. There's a lot. And then, so, in the presence of smoking and electronic smoking device emissions, so that's the vape that comes out. And then the scientific studies have demonstrated that just the addition of the electronic smoking device aerosols are just as harmful as smoke. cigarette smoke.
I have a question about that.
Mhm.
So I see in public places where smoking is banned. I see people still vaping and thinking that vaping is okay. It is not though, is it? Yeah, as you said, the fumes from the vape are as bad as the fumes. Yeah, I mean, I don't say anything, but I see it so often, that's why I was wondering about it.
Yes.
So,
And, yeah, and our smoke-free air ordinance, I think, is within, is it public entrance? But inside a building, it's altogether. No, public. And we do, there are some definitions of what is a public area. And that's don't worry about. So then again, just adding that, electronic smoking device emissions results in serious and significant discomfort.
So does that also, I mean, it doesn't specifically encompass marijuana, but will that need to, or will we look at that when that need arises, or,
Or like if they do allow for
well, just the same thing, because this says, you know, specifically tobacco, that's all. So we'll just, that'll have to wait till kind of.
Yes, and there are, I think Wood and Clark County did their own THC ordinance too.
Okay.
So it might be something.
Right, I mean, I don't,
is that somewhat redundant?
Don't, it's, so, yeah, there's just enough little.
right, it is.
Well, I'm thinking since it's not legal anyways, and that
Well, right, that's what I said, when we have.
if it does become, then we ready.
Yes. Thank you.
Just
I think the next couple are just like grammar.
changing things.
Was just further defining the areas of, because we had fairground buildings was the only way that we were more specific, because there are places with fairground. Also adding Kirsch Preston National Foods.
And we did run that past our facilities and Worcester.
So yes, so there are some areas in the fairgrounds that it's allowed. I mean, 'cause that can get kind of messy when you've got campers and people, you know, want to smoke it. You're fine.
Well, yeah. Is running those people down the cigarette.
Well, exactly, that's why I'm just kind of like, yeah, kind of, I know and so much of it is outside.
Yeah.
It's just kind of hard to,
Yeah.
it's hard to manage. I'm just curious, thank you.
Programmers. Removing of those. Right, and then
So smoking and vaping signs.
next changes are more related to the health officers of this, their.
Some tobacco products. And so they would turn off their vaping device or put their cigarette.
More the definition, the intent is still there, it's just.
I have a question, I don't want to get. But, you know, I see it says nicotine. And I don't know if this is an old wives' tale or not, but you know, over the years I've heard that it's more addictive than, say, cocaine or recreational drugs. Is that true?
Those caffeine.
Yeah.
Big opinion.
You know, and I smoked crack a day for 20 years, so there's no smoker worse than an ex-smoker, you know, so to speak, so, yeah.
General question, has there been much issue, enforcement questions? You know, has there been much activity in all the stuff that you guys do? Has there been much issue or questions brought up with this, what's been established for, I don't know, how many years? Ever since kind of the smoke-free thing kind of went through. I know there was a lot of pushback when it first went down and whatnot, but
Yeah, and the enforcement piece does fall back to the health officer, so he wants, the chief wants, do a citation, and they work that through the.
sure, I'm just saying, just in general, has this been something that's even been much on your radar?
At first, there's.
Let's say at first, I'm just thinking with all the things you guys got going on, I mean, it's good to clean it up. I'm not saying that, I'm just saying, is it really something that,
There was a tavern, in Polk County that allowed smoking,
Yep.
there's probably more than one, but
Yep.
I think there was one,
Yep.
that person would think about all this.
sure,
And, it just, it wasn't, so.
however,
So we do compliance checks also for tobacco sales. Yes.
I think it's hard, the products keep changing so rapidly. So I think that is their biggest concern, is making sure that as the products continue to change and other laws change, that our local things are changing. Our years are changing too. Keep up with products, keep up with the hardest part.
Biggest change, like, if it's not addressed in our ordinance, is the, flavor. Yes. Flavors are not permitted anymore, so only, FDA approved, which is your. Animals are owned by. J. Reynolds and
right,
bigger companies, so they kind of have the market right now. But so if you folks walk into a vape shop, a smoke shop, or whatever, they should only find. Juices they're called, no flavors, just because I think that a lot of stuff was kind of more trend, you didn't know what you were getting. It was the homemade concoctions, and it's not what was in it, so now it's being more regular.
a big issue too, that they built a lot of these flavors on these vapes for really enticing younger.
Yes,
Maybe
it's different.
Yeah.
But just three more got approved last week, so it's just like,
Oh, oh,
so
okay.
like, just when you think you have
Yeah,
a standard cap, it's evolving.
So, again, not to get in the weeds too much, and maybe this future agenda item as well. But what about them? And now the federal restrictions that are going to go into place for hemp farmers and hemp products. Is that something we're going to do at this point?
And all of it is the Delta 8, Delta 9 gummies, like it's all just.
Yeah, so we put down these drinks and. This ordinance anyway.
Well, maybe that's something for the future agenda. I don't think we can take that closer look at, and maybe those restrictions aren't in effect yet anyway, so maybe it's no point in talking about it until that is gonna come into effect, but it crossed my mind. So we had to blurt it out before we got it. Okay. Go ahead. Sorry. Is that kind of basically, we went through the suggested language cleanup? Yep, I don't have any issues with any of that. Does anyone else have any questions or, days online? If, Gabe, do you have any questions about this?
No, not right now, I don't.
Okay, I think that is. Okay. Good, with that then, I'll look for a motion, maybe to make those revisions, and does that need to move forward then to the county board? Yeah, okay.
I think we were gonna, Joe, correct us if we're wrong, were we gonna do one swoop of all of the
Yeah.
changes? I think so. Okay. So I don't think we need an action item on this, do we? It's not an action item.
Not
anyway.
necessarily. It could be by consensus, just say those changes are fine, bring forward the resolution that make the changes, and then this committee will still have to see that resolution, and then it'll get sent up.
That sounds good. It would appear that we have a consensus of that, so I think that we're ready to move forward to agenda item number 8, which is the Golden Age Banner update. So Dana, we'll look for you to provide us with that.
Sure. Welcome to Golden Age Manor, everyone. Thanks for coming to our meeting today. So I'll just give you a little update and then have time for questions. So census wise, just to give everyone a reminder, so we're licensed for 85 beds. We are not looking to be at 85 capacity due to our layout and our staffing and kind of post-COVID kind of settling where we, want to be. We budget to be more around 60, 61, depending on our case mix. But good news for 2025 is our census has been up. So just looking through November, since that's where we're at this year, 2024, we averaged about almost 59 residents. 2025, we're almost to 62 residents today. So we've definitely seen an increase this year, which is good. We did open our hospice suite a couple months back. So if anyone wants to see that afterwards, I'm happy to give tours. We haven't had a lot of activity yet, but still, working in the hospice suite is open to anyone. We did partner with Adderley Hospice they helped us furnish the room. But it's open to anyone. So meaning other hospice agencies, people that aren't on hospice, whatnot. So we have that space here, which is a beautiful space. It's going to be really great for anyone that needs to use it. CNA training has been another thing we talked a lot about. So for 2025, we so far have trained 16 students. We do have one more class starting right at the end of the month, but kind of the most exciting part is of those 16, 13 are still employed here in some capacity. So they're not all full-time or anything. We do train a lot of high schoolers, but some really great kids that hardworking kids that are looking for a career in healthcare typically. So that's pretty cool that, from January, 13 of those folks are still employed here. So that's exciting. As far as other staff, we've had some key changeover this year with our social worker retiring earlier this year who had been here 35 years. So that was a big change, but Anna Polk is in that role. She came to us from the county about 8 months ago. And then office manager wise, Teresa has been meeting before, but she's been with us about 6 months. So a couple big changes there. Otherwise, as everyone, knows, we do have a lot of, I would say, industry wise, we're below average for our turnover and changes, but we do have movements, regularly within CNA roles. Nursing is very steady. We did have 2 nurses retire at the beginning of 2025, and we have replaced those positions with newer nurses. So that's positive. We do have a part-time nurse position open, really is all we have, kind of a PM night shift role, but we do have some casual nurses who have been filling those. So we don't have any traveling nurses on staff. That's always good. CNA wise, we are looking for some help on PM and night shift, but again, kind of the standard, rotation of people, and we're always looking to bring people into our training that'll take those positions as well. And something else we've talked a lot about at this committee through the years is our international recruitment. So that is still out there. We have seen a little bit of movement on that, but nothing real specific yet. I did get some information last week, but our attorney that's working with that was going to send us a more detailed update. We haven't gotten that yet. So kind of waiting on that, but it is still out there. What that means, I will definitely let you all know when I know more, but otherwise, kind of building wise, we did do our kitchen update end of last year. So that's still, that was a big improvement. Right now, we're doing some cabinetry updates, I would say. Furniture closet, they're kind of a modular closet. So our closets were original to the building. So, very, over 60 years old. weren't quite functioning, so we have some modular cabinetry work that are going in actually right now as we speak on West Wing, so that's been a big project for the maintenance staff, but, we'll be, they're beautiful, will be really nice when that's done. Otherwise, that's kind of in a nutshell, if anyone wants anything more or more specific, feel free to ask questions.
I just have a comment.
Yeah.
Couldn't help but notice that there was a social media post. Which, you know, I don't put a lot of stock in, but I do like to read them to see what's on. It's fine. Sometimes it's things. And one of those, for those who missed it, was about from a CNA posting anonymously about the care facilities in the Avery area, and which ones were the best to work at, this and that, and there was a little trashing going on there, you know, here and there, but I did not see, unless I missed it, I didn't see one negative thing about Golden Age Manor at all. Not one. And I believe there may have even been a couple comments in there as well. So for what it's worth.
Right.
Was that correct?
It's good to be on the positive end of that.
Yeah, yeah. And when, yeah, so much of it is negative that it's good to be on the positive end.
Yeah.
There as well. So, yeah.
I have just a question
Yeah.
as far as there's been some, I've been hearing anyway, some concern about, you know, the big beautiful bill and cuts and whatnot. And what's your, I mean, you don't know what you don't know, right? I know
Right.
that, and we don't know what the future will hold, but kind of in a nutshell, what does it kind of feel like to, in your shoes?
Not, there's not a whole lot of worry for us right now with it, to be honest. We're seeing, Medicare rates going up for next year. You know, Medicaid, it's still kind of not sure, but for our industry, not a ton of, concern at this point. Yeah.
It's a couple of years out.
Yeah, so there've been, you know, some movement here and there, but nothing that I'm super concerned about or that are, you know, follow leading in Wisconsin is kind of our state association. So we kind of wait for their review and guidance and nothing super worrisome right now.
Okay.
Yeah.
Anyone else have any questions for Dana or comment? I hear nothing from the
All right, well, thank you.
Thank you.
So, yes, thank you for that. Agenda item number 9, discussion of rules of order. I asked Kathy to put on the agenda. And the reason for that is it has occurred to me that we have citizen members that probably aren't familiar with rules of order as much as the county supervisors are. So I thought it would be a good opportunity to, you know, just maybe kind of review some key points. I was going to ask Mr. Loso about a couple months ago, he sent out an email to all the county board supervisors that encapsulated a lot of the rules of order issues that he sees come up. So, Joe, I was going to ask you, can you send that out as well to the citizen committee members of our committee?
Absolutely. I can take a look at it and make sure there's not anything that would be potentially confidential communication directly to the supervisors. And if there is, I can remove it and make sure to send it out to the citizen members. I don't think there should be anything in there that's confidential, but yeah, I can absolutely get that done. And I also want to apologize. I was over in the government center. I completely forgot it was at Golden Age Manor today. So I want to apologize to you, Chair, and to all of the committee members for not being there in person. I would love to be there in person, but I wouldn't have been on time if I was. So I apologize.
Okay, no worries. I'm just glad we all beat the weather
He was walking in when I was walking out.
today. Something that I do want to point out is cell phones. So we all have a cell phone, which is great. So in our rules of order, we're to refrain from using our cell phones during meetings. And please correct me if I'm wrong, Joe, but that is due to the possibility of open meeting violations. So supervisors or any committee members shouldn't be texting each other, shouldn't be texting staff, because we want any questions you may have for staff to be out in the open for all of us to hear. I got my cell phone sitting here, I got it turned upside down. I have it on, I have it muted, but I do have it there in case the fall alert for my husband will go off. Then, I need to have it on. So, not to be overboard on it or anything, but just so everybody's aware of that as well. But otherwise, I'm not gonna spend too much time on this. Joe is gonna send out the email. It covers things like you may not know, for sure how to get a resolution on the agenda, or how to get a resolution formed, or how to get, and we have different methods of doing that, which are outlined, as well as how to get agenda items. So I just wanted to bring that up for our citizen members who haven't probably had any contact with any of this at all. So with that, I think that I'm ready to move on if everyone else is. Number 10 is our administrator update.
Yes, Madam Chair, just a couple things. Sales tax was down in November 39% from last year. So that's quite a bit. December 1st was declared Snowplow Driver Appreciation Day by the governor, which he does every year. You'll start to see at the county board level of WCA, the state legislators are starting to take up funding transportation, $1 billion shortfall in that, since they went away from the gas indexing. So there'll be some resolutions coming forward for county boards as support resolutions on that. Atlas Dam work has been deferred to spring by the contractors to work in their contractor. Grandstand, ironwork is done. Work to resume in March 2026. And any walking bridge we're waiting on closing ground. And I noticed last week they pushed a road there through the field, so they're getting ready to start replacing that walking bridge. And that's all I have for the moment.
Just for clarification, because I don't know exactly what it means, I have an idea, but I'm not sure. So the state went away from gas indexing, which affected transportation funding. So can you just do it really quick? What does that exactly mean?
They used to we get gas indexing inflation, so gas tax raises.
Got it. Okay, so now it's just a state gas tax. Okay, so it's a flat gas tax. So thank you.
No, we haven't changed it with that. It's our legislative action.
Yes.
We discussed that got county convention, and there is a couple of bills now to bring in gas tax indexing back, and I think that's the only way that we probably can play. I think the index has been on probably 7 years, would you say? Never want to hit the highway?
I think it's quite older than that.
Think so?
Yeah.
Not over 10.
So I don't think the federal funding side has been changed since probably. So it's been right now at the state level, it's been things for the general fund to the transportation fund, so they're taking out other funds on transportation versus having transportation funded on their own. And that's what they're trying to do.
The indexing really hasn't changed. That's been for multiple years. They haven't had gas indexing. They've decided now that they're not going to reallocate funds.
Correct.
So they're gonna leave that fund.
Right.
In the revenue.
They're changing that moment right now. So it's fun.
I would say
Sure, got it, okay. So
I'd
that's a
say
little
they've
different
done
than
a shortfall.
something than the fact that they just changed indexing. So if indexing's been gone a long time. It's
Yeah,
just,
next year from now.
got it. Thank you.
I think we went by it all the time. Gone. Political football.
Does anyone else have any questions or anything for formal today. Okay, that we will move on to Helen with, communicable disease report.
So we're moving into respiratory season. Polk County's influenza B visits are low activity, but they're increasing. COVID-19 is low activity, increasing. RSV luckily is very low and stable. Watch that. No Wisconsin measles case. Yeah.
And it's not rabies.
And it's not rainy season, yes.
We'll wait till spring. So, okay, thank you for that, Helen.
I just have a quick question. So
Yes,
your information that you get like weekly, monthly reports from local hospitals, or is it a state report? I'm just curious as far as kind of, it's a lot of information to try to get your hands around. So kind of where does it?
That is a very good question. From different sources. So we have a certain number of communicable diseases that are reportable from any lab or medical center that's testing for them. So that is this information that goes directly from a medical center into our system. And those cases we follow up on, making sure people are staying home as needed, they are getting care they needed, any other contacts that we need to be connecting with. So that's where we can pull how many hospitalized cases Polk County has had for COVID and influenza. And then we can pull information from the hospital systems, also report like their emergency department activity. So people seeing for different, so based on the codes that they're putting in, we have access to different systems to look at those.
Like respiratory.
Yeah, and then the state also has multiple dashboards where they're looking at wastewater results, because they're testing for Mpox and COVID and influenza and RSV in different counties. Polk County doesn't have a wastewater program going right now, but based on all these pieces of information, we can look at that. Yeah,
It's all known data, what's known to us, because if somebody goes over to regions or somewhere, it may not come back through our web system.
sure. Or it's delayed.
But
It gets-
right, yeah, so it's, I would say, and especially during COVID, because there were so many, we would say known deaths or known to us because of that lag time and
Okay.
whatnot. Sure, it's the best information we have.
Well, right, I just, it's like, it is a lot of information. I'm just curious kind of how does that all?
A lot
funnels
of pieces
in?
put together,
Yes,
yeah.
how does it get funneled? Yeah. Thank you.
there is two, local wastewater treatment plants are required to do water testing and wastewater testing. And although I can't rattle off the top of my head everything they test for, also if there's something like E. coli, or some of those things, they test for that as well. So. Any other questions? Does not appear that there is. So our legislative event report, I guess before we launch into that, Tony, you want to give me the history of this agenda item?
Yeah, so back in pre-COVID, it was basically the three points, Sanford, Polk, and Pierce. So we get together and have a legislative roundtable. You would remember that, right?
And there is been
Yeah, but in Richmond, we would gather and get the legislators together and just talk about the issues that we were having in the health and human services. So it was just good networking and collaboration, and then we would bring that back to the committee and report. Was it quarterly meeting?
quarterly.
It was quarterly, so then we would just bring it back to the committee and let, give the update on, you know, what's trending or what are the legislators working on or what was happening. So that's how that item got on.
Because
I don't know how it got on as a monthly, but
Yeah.
yeah.
And, you know, I mean, as supervisors, we get that report certainly at every county board meeting. It's not something that the citizen members get. So I just wanted to, you know, in the interest of maybe getting repetitive, I just wanted to kind of check our pulse on that. If we want to keep that as a standard agenda item, you know, for our citizen members, or if we want to, you know, maybe think about having it, just for things that we would refer to this committee. I don't
I
know.
give a report on the legislative update every month. And I also do it to town meeting.
As well. That's nice.
And there's usually something, a week ago, not this last Friday, but a week ago Friday. And, when we have, what they call a steering committee, Unless it's on site, I haven't had the county board meeting. Go right, the topic was, health and human service. So, I had some notes.
Well, we certainly want to hear that. I mean, that definitely, without a doubt, definitely needs to this committee. And
Well, I generally have to use every month.
you can keep it on there. and it's not a
The
big
topics of, for the county clerk. Health and human services, all on that Friday. And, there was, and we did talk about indexing on that particular.
Well, that's interesting because, you know, as a committee chair, I've never been made aware of that opportunity. So I would appreciate that. And then we have other committee members here as well that may be interested in participating in that or whatever. I guess I've never seen
You're
anything.
talking about the legislative.
Yeah, no, I'm talking about the thing that John has been sure. You know, I've never got anything from the county clerk about any of that. And as well, it does say in our rules of order as our duties for health and human services and our other committees that we're supposed to be attending this stuff as much as we can. Which I understand everybody has obligations and has a life that, you know, they may not be able to do that. But maybe if we could get a blurb put out about it, just so people know that it's available, if it's something that would work with their schedule, that they can attend that if they would like to.
Well, I thought it was, everybody had a chance, Tanya, to talk on that, and George was there. And I thought that was one of the most informative, I remember a time at our state convention, we had 6 resolutions, and 4 of them I went together with other counties. That's how really you get some impact when we can get some like co-sponsors and like this building that we're trying to get. I went together with 3 other counties, so whatever, 4 of us. And I remember Sheriff Rod Knudsen down in St. Clair County. I remember one of the meetings that we went to, he just broke down in tears. And he said, I do not have staff enough to, when he had to transfer mental patients. He just broke down in tears and said, I do not have staff enough, he said, to do my regular patrol work and county work and then send 2 guys. Because, and, I think probably at 20, if somebody broke loose, down at a very truck stop or something.
Yeah.
They had to go to the bathroom. So now we always have to have a deputy ride with the,
Sure.
and then a deputy driver, and it's still the biggest need we got, and we try to put together.
I think for the crisis ad hoc that we did together, we had some really good collaboration with those other counties. And we had talked about dividing that legislative event on that quarterly basis. So if the committee would like us to explore doing that, we could, get back to that. And county supervisors and committee members are always welcome to attend that meeting. And like Supervisor Bonifay said, it's very informative.
Oh, it was
And
awesome.
it's a really good meeting, so if you would like me to connect with those other 2 counties to get that going again, we can do that. And then, bring that report back to the committee or, and then when Supervisor Bonifay goes to, as the representative for the county on those steering committees, he can bring that report to, if there is something to report on.
And John, even at the 3 counties that were always there, they had communicated with other counties. So we pretty much got, pretty much after what was going on in whole northern Wisconsin. And that was always something I looked forward to. That was the best.
Yeah, Gay might even remember those from back when she was on the legislature.
What's the question?
When you were, in the legislature,
Yeah.
those legislative events that we had down in St. Croix County. You would attend those?
I think I did. I honestly, I can't remember. But, I sure would have if I was able to, because I tried to go to everything.
Yeah.
Because I just think it's really important.
What these events, the ones that are kind of sponsored by the Wisconsin Counties Association, is that, or are they kind of like a local, more of a
This
local?
was just strictly local.
And I'm just, as I was looking at the rules of order, it just kind of jumped out at me and I was like, oh, are we supposed to be doing something with that? Because, it has the Health and Human Services, and we shall attend as possible. Public health legislative events, regional board of health trainings, and agency professional advisory. So, I appreciate, John, everything that you do, and I know that you make mistakes,
We have to be at the table.
yeah, and, so I just did want to bring that up too, just so if there's other committee members here that are interested in that, how can we get something put out either by Tanya or the county clerk's office, to our committee, just letting us know when these things are in case if it would work out for us to attend. I understand it might not, but if we don't know about it or know that it's available, then
I think there was always a legislature there. Rob Stafford was, he wasn't a senator then, he was an assemblyman. And I know Rob was usually out there. There was always somebody directly from the legislature there. And then you could ask. And we even had some drafts right there from that committee that our legislature would take. And I think they felt it was important to hear the pulse of.
Yeah.
of the
Yeah,
problem.
Maybe saw that would be
yeah, definitely. I mean, they want to hear from us. So, Burnett County, one of the APRC board members, he had previously chaired the Burnett County Health and Human as well. And he was telling me about a kind of informal group of health and human service personnel. And I believe also some of the ADRC, since those things are somewhat work together, that they have a regular meeting as well. So I don't know if that's the same thing with him, that you did that or not, John, but
I think that's a collaboration between RC and health and human services. So like our EPS minutes and our.
yeah, I think so.
There's so much crossover between the two that they want.
I could ask about that and then, they can, it will go. Because he asked me if I want to come, if anybody's interested in attending, any of those things.
It was the COVID, that stopped that.
Yeah,
And
yeah,
we
shut
just
that
haven't
down.
got it started again.
So question for Mo on this. So we went ahead of this and supervisors started going to these meetings, like this committee or another meeting. That would be on our own time, but we're not always. Yep, okay.
Would it be also then, something that sprung to mind for me right away is possibilities of having one? I don't know,
Like a one before.
yeah, it's possible, it's not likely, but, it's possible as well.
Was.
I would think some of the meetings we want. The broader legislative. Not staff.
Yeah. Yeah, what he was telling me about was not a staff, it was an elected official. That Burnett County does, but anyways, I can shoot him a. So, anyway, are there any other comments or questions about this? Just, if there's any sense of, maybe being, if we got a notice, then we can take this. Whether or not they could attend that. So, it's not an action item on the agenda. Is that anything we would need to take action on officially? I didn't think so.
Chair Robinson. For the work plan that's coming in, do you want that standing agenda item every month. And then the quarterly, are we getting that? You want us to get that quarterly events coordinated again?
What's the consensus of the committee? Would we like to keep this as a standard agenda item, a quarterly agenda item? Do we want to try to put back together that previous group that had met quarterly, was it?
So in the past, pre-COVID, when you were doing it, I mean, did you have a pretty good turnout of legislators, or at least there was somebody there every quarter?
Yeah, we would.
They take us a little bit to get on our schedules to get going again.
Oh, right.
But it was pretty good attendance.
I don't know, maybe if you could explore that and see if there's interest in putting that back together from the county side. Does that sound like a plan for everybody? Did you have anything else for us today?
I don't think so.
Okay, because I don't want to short circuit you.
No.
Okay. Okay, yeah.
I just been on kind of the rest of it, or like the local meetings or the types of meetings that, if we left it as a monthly agenda item, would that be an appropriate time to say, okay, this next month, here's what's coming up? If people want to attend, so then it would actually be kind of, when we're in the meeting, thinking about HHS, and then it's like, okay, here's what's coming up the next month, or would that be too cumbersome?
I mean, we can do that too. I like emails because I can go back and review it. So, I mean, no reason why we can't vote.
Okay, yeah, however, I just, versus like an
That's
email,
a
like,
great idea.
hey, in 2 weeks or in this, that way, if we did it like monthly, then it's like, here's what's coming up in the next month or the next 2 months or whatever.
Okay, if we're ready, we're going to agenda item number 13. So let's start off by taking a look at our work plan. So it looks like in February, we don't need to, anybody feel like we need to do it every time to put on.
Can we do January?
Oh, I'm sorry.
Yes, just because I see we have this on there. We table that until unless we we don't have to have it as a. Or did somebody ask for that to be on there? Okay, so I'll scratch that. And then we would be presenting non-alcohol compliance checks.
Yeah, February. Don't leave unless there's something urgent.
Just curious then, as far as, so we've kind of gone through the health and public welfare. Where, do we need to schedule a public, or will there be a public hearing scheduled for kind of the changes we made in the first part? And, or does that not to be part of, does that not need to be part of it?
Joe, what would the process be for the health and human service or the human health
Yeah,
hazard?
thank you. Human health hazard, because there was
Yes.
enough work done on that one that I was just curious how.
You want to know how we're getting it in front of the committee to get in front of the board again? Is that the question?
Right, does
Yeah.
it need to go, do we need a public hearing? Does it go in front of the board? Yeah, kind of, and do we have, does that need to be on our scheduled agenda as far as this is when we need to get this taken care of?
Yeah, so when we create the resolution, we'll put it on for a public hearing at that point. Because it is an ordinance change, I believe it needs to have a public hearing. We can do that probably as part of this committee. And then after the public hearing is conducted, send it on to the board after this committee either votes up or down or changes or does whatever this committee is going to do. This, I would say, is staff-driven legislation. And so amendments theoretically could happen at this committee level, either before or after public hearing. So when we draft a resolution, it'll come in front of you again for public hearing and then for you to discuss one more time.
So who conducts the public hearing, our committee or the county board?
Committee.
The committee? Okay.
So as far as the human health hazard, ready to go, we've already vetted.
Yeah.
That's right. We just need to accept the changes that you agreed on.
Right.
So we can get that in front of you and schedule a public hearing. Correct, Joe? next step would be a public hearing in January or March.
Absolutely. And then if anyone on the committee wanted to make amendments at that point, when it's back in front of the committee, you have every right to do that. The changes that are on it right now are not final. They are just what generally was agreed to by the committee and basically recommended to staff to make the changes. So
So it'd be in draft. It would still be in draft.
well, it would be, it's still, it's the proposed resolution. So the resolution will include the language of the ordinance. And then you still have the right to change it at that point. Just because that's the language that's being proposed doesn't mean that board members and committee members can't change it.
So, I'm sorry, I apologize, I'm having a little trouble hearing. So forgive me for asking questions probably already answered. So what we could we hold a public hearing in January, or do we need to officially act as a committee to accept, that the committee accepts the proposed changes? Then it goes to public hearing, or we can just have a public hearing and make any changes, if there would be any changes then, or how does that work?
You should be able to put it on as the resolution is. So your question is, do you need to contemplate the resolution, basically approve it as its form, and then put it in front of yourself for a vote to go up? That's your question?
Yes.
I believe you can put it on for a public hearing in January if you want. I will double check that, and if that's not true, then we won't do that, and we'll make sure that we have it correct. But I believe you should be able to do that.
In January? Okay, so that's,
So we would do like we do with the budget, half an hour before. There are public comments, we then could address them in the form. Right?
Well, you just, in the committee, it'd be 7 on the agenda, would be time to public comment. If there's no one there, or if there's 100 there.
yeah, could we just notice it that at 9 o'clock it'll open and. Okay, and then, sure.
But then the committee could act on.
Yeah, that's it. What's it? Public hearing.
Okay. Okay, moving forward.
Add it and then we can stop. So I just want to make sure we're finishing all this work that these guys do.
So also, I know, as far as the public nuisance, Joe and I had a discussion about, doing that crosswalk, and to me, that feels like, Joe agrees that feels as though that's more of a, how do we educate the public on how to find information? I think rather than having a public nuisance, that's just a crosswalk, that isn't really important. That's, just informational purposes. So do we need to work with the muni code or some other way to help the public to get to where they need to go regarding the refrigerator parking or whatever. So as it stands, the swap that we had done isn't really important to this.
Right.
So that's where we would propose this goes away, and that's more on back on the county to figure out how to.
Yeah, I would think that the HHS staff and yeah, would have to be able to figure that out.
Look at our search engines. Search features on the website. That would be.
I don't really want any. So it's good.
But that's where that
Feels-
would
yeah.
sunset in the.
And we're not gonna change that.
But we need to address it on the January agenda, the new system.
But
Whatever, yes.
All righty. Okay, are we ready to take another look on down the line here at our monthly plan? On March, any questions there from anyone? Um,
And these are always subject to change or something like that. Somebody else.
so, April is our division plan. May is budget priorities. June is orientation, even if actions. In November. Along with some reporting, July, we have GAM, so the budget priorities also, some updates. August is our 8:30 AM meeting at the public hearing of budget. September is the presentation. October, if we have any amendments, the medical exam. November would be child support. So is there any suggestions, additions, edits, deletions?
If there's nothing in April, for example, the chair can give its own certificate of updates. You would be able to say this to the
Yeah.
And there's a potential that we could cancel the meeting. There's July. That's up to the chair if she wants to. Chief, but then once we get into the budget, that follows the budget calendar timelines and then restricted on canceling the change. So we can keep this opportunities.
Just something I'm just gonna briefly mention, stuff like that, see, it's the October, meeting. I'm still on this committee then. That's a date that I asked to change. I guarantee you that, right? Yeah,
That's a long ways away.
It is.
yeah, oh, not to me, that's great. So, anyway, if we're done with the work plan, let's look at our subject matters for our next meeting. So we have, our compliance checks, our January work plan, the crisis ad hoc update. Is there gonna be anything?
There's not a crisis.
Okay. Well, that's what you're just talking about. Strike it, okay,
And then I'm striking it down here as a standing.
okay. And then we will have our, our public hearing, nuisance ordinance. And.
Maybe just an update to see if any of the three counties, other comparable counties, have agreed and how that's moving.
The legislative amendment.
Yeah.
Okay.
Just as a point of clarity, Chair, I don't know that a public hearing is necessary for the ordinance modification, just so you're aware. That is something that is, sorry, excuse me, that is something that is at your discretion. I certainly recommend that you have public hearings before you modify the human health hazard ordinance and the public nuisance ordinance, but I don't believe there's any statutory requirement to do so. The only requirement in our rules of order require or basically give you as the committee and as the chair the discretion to hold a public hearing. So that's why the rules about when it needs to be are pretty lax.
Well, thank you. I did not know that. I do think that it's probably a good idea to have one. If we don't have one, I would bet that's something to ask why we didn't. So for transparency purposes and everything.
I'm not sure. All updates this to skip the order to on the work plan.
Dated 10/4/2022.
Yeah, so the last date is October 2020.
I'll remove it on the bottom right.
Okay. That's great. Is there anything else for our January agenda? No? Brad, did you have anything?
Motion to adjourn.
Okay.
Can I make a comment before we adjourn?
Certainly.
Would it be all right if we don't share a lot between committees, but our public protection and parks and recreation under public protection, I was last Tuesday. And so there's gonna be a resolution, I believe, board meeting. We'll be voting on Tuesday. We have three options on this trail. We could have $277,000 spent so far on litigation and everything.
There's no resolution, John. There's discussion, full session on that.
That
Comes forward. Yes.
So what we did as a committee, we voted,
We should.
No, yeah, we should talk about it, John. It's gonna be in closed session.
There was no motion made at public works policy.
reason why I brought it up because it's gonna affect all full council.
We'll look forward to that. then.
There we go.
Here we are.
There are goodies. Please grab something before you go.
And they're very-
On tour, let me know.
Can I entertain a second on the,
Yeah.
on the motion to adjourn?
Motion by Supervisor Wilson to adjourn. Do I have a
I
second?
do.
Okay, any motion made and seconded, any discussion? No, with that to a vote, all in favor of adjourning, respond aye.
Hi.
All right.
Opposed, same sign, nobody opposed, we are adjourned.
Merry Christmas.
Merry Christmas, everybody.